to take in so much. And this is what is resulting in obesity that you now see is rampant at home. It's now almost at epidemic levels. And it happens, unfortunately, among the so-called elite or affluent. Obesity is now a problem. And then we have the frequent bouts of cerebral malaria in children and malaria in adults, which is as a result of poor sanitation and inability to use or afford preventive measures. Now, the challenges. The first thing I found out was that there was a lot of ignorance. People do not go for routine checkups at home. And so you see people go to the hospitals only when the disease has progressed to a very high level. Most of the people do not even know their medical conditions. So somebody has a condition, because the person does not present himself or herself to the proper authorities, the person doesn't even know what he or she is suffering from. There is also this difficulty in abandoning lifestyles that people have been used to. And sometimes this inability leads to these conditions. And there is also something else I found out, which is the fear. Why some people who know that they go for checkups, they don't go, out of fear of being told the truth. They don't want to be told you have this very bad disease. They don't want to know that, and so they don't go for these checkups. There are some of these challenges that affect the general population, and the very important one we all know is the lack of access to proper health care, the lack of adequate infrastructure. The hospitals are either not there, or where they are, there are no facilities, there are no resources, there are no drugs. And so you see people self-medicate. Where the resources are available, the people can't afford them as a result of poverty. Or when they go to acquire these drugs from the right pharmacist, they tell them that this drug costs 20 naira. And then they walk across the street, they go to one of these drug stores, and they tell them you can buy the same thing for 5 naira. And they, out of ignorance, because they are told that it is the same thing, they go and buy the cheaper one, which is actually not the same thing. And that's why I am a subscriber of that advertisement that Panadol used to make in Nigeria in those days. They said, if it is not Panadol, they tell you, because when you go, they will tell you, oh, this is the same as Panadol. So Panadol came up with this argument. They said, if it is not Panadol, it is not the same thing as Panadol. There is one other very important problem. People are unable to distinguish between a nurse and a doctor. Many of us know this. They call nurses doctors, and they go, when they are sick, they go to the nurses, and they expect to get the same treatment that they are supposed to get from the doctor. The nurses have their specialty. The doctors have theirs. Our people patronize this one they call quacks. There are a lot of people who are answering doctors back home who are not even nurses. They are not even health professionals. And they are called doctors, and people patronize them. And the reason they do that is because they don't know the difference between the quack and the real doctor or health professional. And also because of poverty, they are able to pay for these services that are rendered by the proper health professionals, and so they go to the parks who charge them less, and most of the time do nothing for them. And our people only go to the hospitals when they're already dead. That's true. The person is sick, he's staying there at home, the people family members are surrounding him, they are looking at him. When the person wants to die, then they will carry him and rush him to the hospital. And oftentimes you go there, the doctor will then ask them. I remember when I went home, there was an incident that happened like that. One of the doctors, a friend of mine, was asking them, so what do you want me to do for you? I'm not a magician, I'm only a doctor. There's no way you can bring somebody who is already dead and you expect me to bring him back to life. So these are some of the challenges that are affecting the health care of our people. And so I just threw them in. Many of these are the things we already know. There is a high level of ignorance. There is high level of poverty. And these are, and then the lack of infrastructure, facilities, the resources that is causing what is going on. So I just wanted to bring this up and so that we can then inform about contributions and resources.
Any questions? The floor is open. Dr. Cook will answer your questions, and we'll quickly wrap up this section so we can all quick short break.
Wonderful presentation. It ties in with what the subject Dr. Ewa covered and what we're going to talk about later on regarding education. What is the role of government? If I can want to get and open a pharmacy and I can prescribe whatever you want and I don't know anything about medicine, does my government have the right to set standards, legislate standards, laws before you can, qualifications before you can open a pharmacy? Or practice medicine when you're not a doctor? So governance comes into play when we have proper government. But another problem is the education problem that we identify. They're all tied in, together. So I think our problems rotate around those issues. Education, good government, government has the right. What is one of the main functions of government? To protect the weak, the less powerful, to take care of its own people. If the government cannot look after its own people, who can? So I really appreciate the presentation. It ties into everything we're trying to do, and I think we need, you posed the question of us earlier, we have to find a way for the local government to publish in X-ray what their budget is and what their contracts, who their contracts are awarded to. Transparency is crucial to what we have to do.
To answer your question of regard to what the government is doing in regulating these medications or something like that, they do. They're in the process of doing that, and most people now don't just go own a pharmacy like what we used to call it, a chemist. You have to be licensed, and they really have to test to make sure you have the certification for you to be able to do that. And they're also regulating some of these narcotics. Like, before you can just walk into any of the drugstores and get like Valium or all that. Now, you have to have a prescription to be able to get that. So they're doing something for that.
That's an isolated. I was going to say exactly what she said. I have a friend who is in Nigeria right now. She's a pharmacist in Georgia, but she's starting a new pharmacy in Lagos. And a bunch of regulations that she's going through, she's been going back and forth because of all the regulations that are trying to put in place. But the problem is that the regulations are there, but there's a lot of corruption. By the time you get through that phase, she's going through that phase to get it set up. By the time she goes through that phase and gets established,